who is the ultimate customer in digitization? Is it the payer, the insurance company in places where there's a lot of penetration of insurance, like, say, the United States?
Yeah.
Or is it the hospital or the clinic? Is that it? Or is it the patient? That's a big question. And depending on where you fall on that debate and who you think is the ultimate customer, I think the patient is the ultimate customer. But depending on your point of view on who the ultimate customer is, then what you build and how you go about building it is affected by that.
Welcome to the Rozy Effect, where I give you the keys to lead digital transformation. I'm your host, Rozy Amponsa. Today's guest, Dr. Muri Raifu. Dr. Muri Raifu is a board-certified neurosurgeon and a graduate of Masters of Public Administration program at the Harvard Kennedy School. He left home in Ghana at the age of 15 to attend Breck School in Minneapolis on an international student scholarship in 1991. He then attended Amherst College in Massachusetts, where he was a student athlete and graduated with honors. Dr. Raifu was a pioneer in the area of genetics by successfully designing DNA primers for blind PCR amplification of immunoglobulin genes. These primers are currently in use at several labs around the globe. Dr. Raifu did neurosurgery residency at UCLA, where he served as chief resident in his final year. He's been credited in several publications ranging in subjects from genetics, spine surgery, radiosurgery, infectious disease, and endoscopy, computer-assisted brain surgery. Dr. Raifu was an attending neurosurgeon at New York Presbyterian Hospital, Queens, a level 1 trauma center, for 5 years. He also served as a director of neurosurgery at California Hospital Medical Center in LA from 2015 until 2018. He's committed to finding innovative ways to effectively deliver healthcare services to those in developing economies. To that effect, he founded Thalamus Health Inc. in 2015. Its award-winning product, Thalamus, is a mobile-first, cloud-based application for comprehensive clinical output, which is currently being used in Ghana, Nigeria, South Africa, Zimbabwe, and the United States. His company was named to the 2019 list of World's Most Innovative Companies by Fast Company magazine and was a recipient of the United Nations ITU Global Award, or the Most Scalable SME, in 2018. Dr. Raifu was currently appointed to the Africa Union Africa Center for Disease Control, CDC, Task Force for COVID-19 Management in Africa. We're talking digital transformation in healthcare. The perfect person to be speaking to. Let's get into the conversation. Good afternoon, good evening. Thank you so much, Dr. Muri, for joining us today. Awesome. We're going to have an amazing conversation with your deep background and expertise within the healthcare space, what it really means when healthcare organizations are looking to embark on digital transformation. So let's delve right into it.
Yeah.
Super cool.
So, as you all know, my background is I'm a neurosurgeon. So I see the issue around digital transformation from both the practitioner point of view, but I'm also a tech entrepreneur. And so I look at it from also a sort of a product point of view.
Yeah.
And of course, I've also taken care of family members. And so I see it from the user point of view. So certainly the big question out there is what does a typical transformation for healthcare looks like? So if you really look at history, I think, from a regional point of view, now a lot of regions are just beginning this healthcare digitization transformation, whereas others have been a little ahead of the time. Say the United States, for example, has been a bit ahead of the time. The Obamacare mandate that forced everybody to basically digitize. So we went from maybe only about half of organizations being digitized to about over 90% of the organization digitized over a period of years. because of the meaningful use law, the incentives that were built in, and all those kinds of things. Are kind of so there's that kind of national policy thing that forced it, because up until then in the United States, digital transplantation has been kind of hodgepodge of one little thing here, one little thing there, and kind of lunging along, and everything else was kind of exploding digitally, and healthcare was just lunging.
Yeah.
So this kind of national mandate kind of forced everybody. The problem with that is that the national mandate gave opportunity for those who had already built a program or were in the space to expand. But they themselves, I don't believe, had already actually solved the issue of how digital transformation should look like. If you look at all big companies, the customer, the ultimate customer, is always the center of the product.
We hope so.
We hope so. But if I'm looking at all across all industries, is what I'm saying is that if they're doing an enterprise sale, for example, they make sure that they understand the processes within the enterprise and then fix it, right? And if they're doing a consumer product, then they make sure that they understand the consumer journey and they build a product around the journey that brings in efficiencies and cost cutting and all those kinds of good stuff, right? There is a bit of a big debate. Who is the ultimate customer in digitization? Is it the payer, the insurance company in places where there's a lot of penetration of insurance, like, say, the United States? Or is it the hospital or the clinic? Is that it? Or is it the patient? Because that's also the complete constituency when it comes to the different parts of healthcare and how people interact with each other. Right? So that's a big debate. That's a big question. And depending on where you fall on that debate and who you think is the ultimate customer, I think the patient is the ultimate customer. But depending on your point of view on who the ultimate customer is, then what you build and how you go about building it is affected by that. Right? So that's where I think the big question is. And I think for a long time, the customer was always either the payer or the hospital or the clinic.
The customer was, say that again.
The central customer for a long time.
It was the pay. Oh, yes. Please say that again.
Hospital, right?
And the patient was actually forgotten.
Was out of it, right? But if you really break it down from a customer point of view, it's the patient who pays the premium. Is the So the ultimate customer there actually is the patient, but for some reason, the way things were structured and where the power structure was within that whole ecosystem is such the needs of payers in terms of insurances and hospitals was met first. So now the debate is we need to start reimagining these solutions and bringing the focus back to the ultimate customer, and that is.
Wow. So how then, with the space within the ecosystem that you are, right? How then should leadership across organizations be able to define what success looks like? Because you've honed in that the patient should be the ultimate customer. Is there value for that to happen? And what should then a measure of success look like for leadership?
So there's a couple of ways to look at it. So if, for example, you belong to a healthcare organization, you're a leader in a healthcare organization, your purpose is to bring efficiencies, right, into your organization. So there is some of these technology that's going to help you do that. And ultimately, the idea is that those are going to lead to two things. Mainly, many other things, but two main things. One, better patient outcome. And two, cost cutting. Right? You want efficiency, you want a cost cutting, you want to reduce wastage, and you want to be ultimately, hopefully, pass some of those along, or savings along to the patient, right? And two is to actually make the patient's experience better, right? Make it easier for them to actually experience healthcare. To look at healthcare as an experience, as opposed to something that people just happens to people, but rather as an experience. It's a journey. So how do you then build in adopting technology it has to do, I think, in today's age. Maybe in the past, people didn't think about it that way, but today, you have to think about those things in those two terms. One, how is it going to help us be more efficient, make us more profitable, even, help our bottom line, because a lot of healthcare is a business. At the end of the day, people think about how is that going to help our bottom line and help us do those things. But at the same time, help us serve our customers better, because guess what? If we serve our customers better, i.e. the patient, right, that also will help our bottom line. It will help our brand, it will help our bottom line, and more importantly, help us fulfill our mission, which is better patient outcomes.
Yeah, better care on chronic diseases, probably less stay in hospitals, because all these measures the hospitals are looking at.
Exactly. And a lot of hospitals have capitation programs. They have all those kinds of things. So, if you're in a patient is a capped patient, having them stay there an extra day because of your inefficiency actually hurts your bottom line.
Yes.
And also terrible for the patient, right? Because the patient in the hospital longer than they need to be, their chances of catching hospital-acquired, diseases increase.
Drastically.
Really think about it, not only from your side, but also from the patient's perspective.
Okay. So right now, we know the pandemic that we're all just navigating and dealing with. How should business leaders go about positioning their organizations in order to not only survive, but thrive in this condition? And I also would like a perspective on what's going on currently with the ecosystem that you are a part of within the healthcare space, and how leadership is really, or how you would advise the leadership to go about positioning the value that they can still bring to customers in the long term. Maybe right now they're doing some band-aid situations to just, sustain. But what is that long-term strategy? What should it look like?
Yeah, I think you hit it right on the head by saying right now a lot of them are doing band-aid situations, right? Because healthcare has always been this funny centralized experience.
Yeah.
And not only is it funny centralized experience, it's this kind of series of siloed centralized experiences. That is, if I belong to a healthcare organization, even if it's a big one, say your UC system or the University of Massachusetts system or whatever system or the GW system, I can probably get most of the things I need, right, within that system. But the moment I leave that system, I'm at a loss.
Yeah.
It's so much work to move my information. It's so much work to get my different doctors from those two different organizations to speak to each other.
Yeah.
It's so much work if I don't go and get my stuff within that ecosystem. I'm struggling.
Yeah.
See, the patient experience is not just when you interact with a doctor. It's when you go out to try and find where to get an MRI. It's when you go out to try and figure out where to go to a pharmacy and get your medication filled.
I've experienced that. Yes, I feel that.
Do you understand? And these issues are even more acute in non-Western countries. Like, for example, it's even more acute. Or finding a surgeon who takes your insurance, for example. Like that, those kind of outside of the initial experience kind of thing is something that has always been left behind. And in the time of a pandemic, trying to coordinate patient care when they cannot travel to this centralized, siloed location, it becomes a major issue. Now you're trying to scramble and figure out how to do it. So I think it's time for us to even think about this whole thing.
Rethink it.
Hold
on. You are really saying something monumental here. Hold on. Repeat what you just said and tell me how that will look like with your vision.
Well, it's a decentralized, federated approach to patient care.
Okay.
Right? And that is de-siloing and disaggregating these centers of information in the way that is centered around the patient journey. So if I'm a patient, I should be easily, with a few touches of a button, move my information from one place to another.
Like that, yeah.
If I'm looking for a pharmacy, I should be able to tap on my phone and find out where the pharmacy is, and maybe even if they have my medication or not.
Yeah.
If I get an MRI done at one place, I shouldn't have to go have it printed to take it to one doctor or another. I should be able to give a login through my permission to any doctor, and by virtue of my permission, have them be able to have an insight and access to that record. Because I've already established a relationship with that imaging center and I have paid them for that service. That's decentralized.
But then how does the payment side of things come into play, right? If we're shifting the path to the patient, then what is that and sort of the back end of things? How would that look like?
Well, I mean, there are processes that are in place already. For example, if you are in an insurance company, it's very clear what is included and what's not included. It's very clear, you know, if you're passing your stuff. Those are already established, right? So, but sometimes it can be even confusing for you as a patient to understand. So why doesn't that information become readily available for you if you're approaching your max, for example? It will tell you approaching your max. If you're trying to go and get a CT scan done, for example, but that will be beyond your max, the insurance company should be able to tell you that, hey, listen, you're going to get these CTs. First of all, you should be able to compare prices of where those CTs are close to you, right?
Oh, you're hitting on some serious nails. Okay, go ahead.
Understand that, and so you have a choice to decide, because that lack of asymmetric information, that lack of knowledge of that kind of information doesn't allow you to choose what's best for you, not only from a financial point of view. So you should know if it's a 64 slice versus 16 slice CT, and say, okay, you know what, or communicate with your doctor, like, listen, it's cost this much to get a 64 slice versus a 16 slice. Or to go to a 4 Tesla MRI versus a 1.5 Tesla MRI, with 5.5 Tesla MRI be okay with you? Because this is how much I can afford.
Okay.
And it may be that for the purposes of what you need to do, 1.5 Tesla is perfectly fine.
So personalizing the need for the patient.
Exactly.
Okay.
And being able to say, okay, I need a CT scan. There are 5 places within 5 miles of me who have CT scan, and this is the cost of each CT scan. This is how much my insurance is willing to cover. This is how much I can cover. And based on that, you make a decision where to go. Based on time, convenience, it may be that you're like, you know what, I don't want to really travel 10 miles to get one that can afford. I'm going to put an extra money on it to do it close by. That's fine. That's your decision as a patient to make. Right? So those kind of information, there's so much work to do around that, because then it allows people to get the best care they want by providing more transparency and more choices to them. And a lot of that is based on unmasking information and making it transparent on the patient end.
Transparency for the patient. That's what I'm hearing. Okay. Let's talk a bit more about the responsibility that leadership has towards these patients. We've seen in the news where AI can be deployed within hospital systems, and it negatively impacts that end patient that you're looking to serve, because it maybe negated a group and a race or whatever it might be, resulting in negative output. So when it comes to leadership looking to embark on technology solutions that is supposed to enhance the patient experience, how should they be thinking about putting together teams, think about really, looking at a visibility into the current state of their people so they can be well positioned to actually deliver something that is inclusive and delivers that value for all patients? That is, right? Ifs, ands about that.
So there are many layers to that, like many layers to that. The first layer of that has to do, first of all, with those who put together the AI in the first place.
Okay.
There needs to be diversity in those companies that provide the insight, because the way you build the AI and the information you feed, so there are 2 sides to AI. Is the way that it's structured itself and the kind of information that is fed into it, right? And as
Right.
any goes, and those 2 things are very critical to any AI system functioning, right? And therefore, it's very important that right on the onset, when people are putting this together, that those at the table having that conversation about this AI are of diverse background and diverse experiences, not just background, diverse experiences, and allowed to be able to bring some insights into how these things need to be structured. So that's one. Number two, so that's the first layer.
Mm-hmm.
The second layer is that, remember, a lot of these, so it'll be good to bring physicians in the beginning, and many of these companies do, but the physicians of diverse backgrounds and diverse experiences. Remember, you could have a Black physician who hasn't really worked in the Black neighborhood before, right? And doesn't understand the issues necessarily. Or you could have a white physician who has spent all their life in a Black neighborhood. So I don't want it to be just about talking about, it's about experiences as well. Have they really taken care of Black patients? Do they really understand on the deep level what the issues are? And have those people around the table when the planning and the building of these AIs are and the tweaking of the AIs. That's one. Number two, in the pilot phase of everything that comes out, the recruitment of people who join should also be diverse. Right?
Yeah.
So that you pick up on these issues before these things go into the community, start doing all sorts of things. And if you can pick up on these things, you can mitigate some of those issues up front. Right? So that's the next layer of it. The final layer of it is that the initiation of these programs shouldn't always go to the fancy academic centers.
But I mean, you're uncovering something here because there's a process to that. There's
usually it's like a big academic institution is where these things get tested. And in some places, you look at Baltimore, you look at Johns Hopkins, for example, it has, but if you go to some other places and test it there, they may not really see much in terms of diversity, in terms of their patient population.
The demographic is so skewed.
The information you are feeding it and making a decision about deployment is based on that. So I will hope that the decision then will be like, if one, we're going to do it, we're going to bring in a diverse, and then the places that they are deployed in should also be places that draws in a diverse group of patients so that we can start to understand some of these issues up front. There are several points, and and all those things have to be addressed,
Yeah. To touch on one of the key elements you mentioned about diversity and the value within the healthcare space, and I love how you touch on the experience and the culture of the individual put together coming into the spaces to be able to help these healthcare organizations lead that kind of change. We still see that the numbers are not there. We see it on leadership. It's not being done. But recently, with the impact of racial tension, a lot of organizations have made that pledge, right? They have stood up, they have made this statement. So how should leadership really go from the conversation to actuation at this point? Because we're all sitting there, we're watching, we're looking. So what's gonna happen, and what is your advice to leadership to take this opportunity to actually create this change?
Yeah, that's always the issue, right? It's funny, people say that when Haiti's earthquake happened, tons of money was pledged and a lot of them didn't show up. Like, as in the country pledged it, never sent the money. And there were various reasons for it. And some of it is like, well, it's corrupting people. Like, people say all sorts of things. My point is that, and I'm not saying that to go into the details of that, what people's reasons are, whether they should have sent it or not. I'm making that using that example to say that often in the heat of the moment, organizations come out and make pledges. But then when the moment phase out, people really don't follow through. So which is actually exploitative if you think about it, because you get free PR, right?
Yeah.
You come out and make the world believe you care about a particular issue. That can translate or may not translate into goodwill, which could lead to your bottom line getting better. But when the next disaster or the next thing happens, and that one is in distant memory, the fact that you never get called to account, for not following through with it. And even if somebody does, often it's in like page 29 of the newspaper in a small part, and nobody really reads. And it kind of fades away until the next thing comes and all of that. So, that always concerns me. And what I like to see is actually people to realize that this is really serious, right? Everybody knows that COVID has affected African Americans and Black folks and even Latinx more than anybody else in the United States, for example. And therefore, there are serious underlying issues that need to be addressed. The funny thing is, none of these issues are new. They're just getting attention now, right? I've worked in hospitals that have, I've worked in a variety of hospitals, some fancy academic ones all the way to county hospitals that see mostly. And these issues are clearly there. You can see the difference between one place or the other and the other. So they've been there for decades. I started my residency I started my school in 1998. I started my residency in 2002. So these are not, and even then, you could tell the difference, and everybody knew it, and nobody could really address it on a systemic level. So I'm hoping they see this as a way to start addressing it on a systemic level, right?
What do you think that first thing needs to be from a healthcare perspective?
Well, it's resources, right? Resources. There needs to be better coverage for people, so people can actually go to seek healthcare when they need it. So there needs to be better healthcare coverage. That's the bottom line. People will not go to get healthcare if they don't have the means to do it.
Yeah.
And then they end up, and we have, the funny, weird thing is, if they show up in the ER, the hospital is obligated to take care of it.
Yes.
So it's like a Russian roulette. But the thing is, they may not show up until things are late.
Things are quite drastic, or they just might not know that they can.
That
availability
so it ends up costing, a lot more than if they had come earlier and some things have been put in place to try and prevent them from getting worse.
Yeah.
So from even the pure economic point of view, it makes more sense to provide more coverage, and to encourage more people to get coverage more than anything. I think is very important. It's just the cost structure of healthcare in this country is such that most people just simply cannot really afford a lot of things.
Yeah.
So you have to address that issue, and whether as healthcare is expensive and all of that. It's not the debate here. It's not what I'm talking about. However, the cost structure is, people need to be put in the position to be able to get healthcare if they need it.
Access to it. Yeah. Let's touch a bit more on the organizational structure and leadership having responsibility to upscale teams. So from a healthcare perspective, I believe there is sort of a melting pot of generations within the workforce. How is leadership really looking at, or how would you advise for leadership to look at successfully upskilling other healthcare leaders that are coming into the pipeline, that are in the pipeline, new technologies that are being sort of presented into the space, still with the end goal, as you mentioned earlier, being able to deliver the greatest value to the patient?
Well, I mean, first of all, I think existing leaders need to learn and study technology. It's time to go back to school, because it's hard to really prioritize and know something that is great if you don't have a means to understand it. And being a healthcare leader means lifelong learning. That's why we have CMEs and all of that. And I think technology should become one of the CMEs for healthcare leaders.
It's not?
Well, it's not. It's not required. I mean, they could ask me to learn about pain management and all those kinds of things, but knowing about AI, all those kinds of things, it's not really a CME. And I'm not advocating like a million CMEs, more CMEs. Since, frankly, there are some CMEs I would love to replace with technology, right? Where, or at least some people in certain positions should, and they should get younger mentors. One of the biggest leadership brains I know, one time I was talking to him and he said something that really struck me. He said, Muri, I have younger mentors. As in, people who are 30 years younger than him are his mentors. On these kinds of things. And I think it's a very amazing thing, in a sign of true leadership, when you are able to actually do that in spite of everything you've accomplished.
Hmm.
Not being afraid to be a mentee to somebody younger than you because they now know something that you don't have the framework to fully understand.
Hmm.
And so there needs to be some of that, where actually people also see themselves who are in leadership as mentees in certain areas
Yeah.
where they lack. And the person who could be the mentor in that area could be the age of your son or your daughter.
Hmm. Talk to me a bit about organizational culture within your ecosystem. As new technologies are introduced into the space, how should leadership really go about what that digitizing the organization looks like, and how the current state of the culture of the organization plays a role when it comes to the goals that they're looking to achieve?
So that is depends on where you are. In the United States, for example, everybody was forced to digitize, and there were punitive reasons for not doing it.
You mentioned
So
that. Yeah.
it is a choice, but to digitize. Now they may not have done it, made the right choices because of lack of knowledge, or they took whatever they could to meet the deadlines.
Mm-hmm.
And now a lot of them are beginning to look again at, okay, what do we have in our hands and how do we enhance it or maybe even replace it because it's not necessarily enhancing or getting to our main goal.
Mm-hmm.
Now you look at somebody something on the continent though, there is layers to that. You know, a lot of the leaders of hospitals are doctors, and many of them are older. So they don't always necessarily fully understand the technology or see the value in it per se. Whereas the customers are all on Facebook and doing everything else in their life with technology,
Yeah.
right?
Yeah.
So because of the lack of knowledge, the urgency of adoption for technology is not always there.
It's not there.
And when you find places where you have younger, more enthusiastic folks, they don't have the political leverage within the organization to make the ultimate decision because there's no thing as most hospitals don't necessarily have a board. Or even if they have a board, the board don't even necessarily also are not necessarily technologically savvy either.
Yeah.
So the makeup of the decision-making body in any organization needs to include young people who understand technology and have the capacity to explain in simple terms technology and the benefits of technology, because sometimes it's about trust, right? If I'm a head of an organization, I don't know something, but I have someone on my governing body who's young. I've worked with him in so many other ways. And I know they have the organization's best interests at heart and they understand the issues that we're having.
Yeah.
And they're talking to me about technology. I'm more likely to actually understand. And even if I have trepidation, I'm more likely to take the jump than if some strange 23-year-old with a tech company shows up and tries to convince me to do something.
Do they have those individuals appointed within the organization?
Much. And then that goes to how a lot of hospitals are organized, right? So there's so many layers to the issue. So a lot of it is actually the leadership looking at it and saying, okay, I know that this is the way, because if I look at my life, I use WhatsApp to write my friend who moved to Germany some years ago.
Yeah.
I use Facebook to keep track of somebody's picture. Hell, I may even use Instagram to look at my granddaughter's picture, birthday or whatever. And lately, probably I've used Zoom to talk about that. Every other part of my life is being transformed by technology. Why isn't my business being transformed by medicine, by technology? Those are the kind of questions people have to start asking.
So often we're seeing the digital world and sort of the physical world, those edges melding together. And in the space of healthcare, you just asked that key question, like, why is the rate so much more slower than looking at other industries, or, the personal patient's experience having access to these digital resources? But yet when it comes to my path to care, there's so many misalignments to actually deliver that value to the patient.
Yeah, that's because the power structure has traditionally hasn't favored the patient.
No.
So the end consumer has always been sort of not the least powerful in the whole system, whereas in many other industries, the end consumer is always the most powerful.
Yes. Yeah.
So it's a very unique feature to healthcare that has kind of led us to this kind of situation that we currently have, right? And that's one issue. The other issue is that outside of nuclear technology, healthcare is probably the most regulated industry on the face of the earth.
Yes.
Right? So that brings another layer of trepidation, right? And those who push the envelope in healthcare sometimes are punished if things don't go right. And so the pressure to toe the line and the pressure to stay within the regulations is so high that for some people it's easier to stay with the status quo than try something new. So part of this issue is also the regulatory side. There are regulations that were written in the 60s in certain countries. You go to Ghana, Nigeria, no. There are some regulations that were traditions from the 60s that people have now really sat down and done a systematic review of, given where we are in the world, given patient expectations, given even our own expectation as practitioners, given where technology is taking us, is it time to really reconsider how some of these things work? You know, and this issue is not just Ghana, Nigeria, even here in the United States. Yeah. I mean, the COVID is laying bare this whole kind of county by county regulation of healthcare. It's why it's so hard for us to coordinate anything.
All the misalignments are literally being exposed.
Right. So again, when I said in the beginning, this is the time to really take a step back and really ask some serious questions on how this whole thing ought to be working. And I think COVID, unfortunately, it had to take something like this, but since it's here, nobody wished that this happened to the world. But since it's here, it provides us an opportunity to really ask these hard questions and take a step back and figure out how are we going to do this going forward, because it will be a shame if another pandemic, God forbid, shows up and we are caught flat-footed like this again.
I just love how you put the patient at the center of this conversation, and you really advocated for ways to have the patient have power on their journey of care. You touched a bit from a global perspective, so I kind of want to sum up with that. I saw that you were on a board for, I think, the United Nations or something like that in regards to COVID-19.
No, not the board, on the Africa CDC COVID response thing.
Gotcha. What's your take on, you know, how on a global scale, especially speaking on the continent, what that process is looking like, how management of the disease state and awareness and processes are going, and what they need to be looking at or considering and, you know, moving forward and healing, or at least positioning themselves to be okay or to be successful moving forward?
Yeah, so a couple of things on that. First of all, there's variation within the continent. You know, we have a big continent, and these have different resources and different experiences.
Yeah.
Right. But what is always consistent across the board is that the healthcare infrastructure in all the countries, regardless of which country on the continent, don't have the capacity to handle like an influx. I mean, even here in the United States, we can't handle it.
Right? No. This is nothing new, or just
but the continent, but it's a little more acute on the continent, and even in some countries, very acute, right? So it gives us an opportunity to think of innovative ways to do things differently. You know, again, this federated, distributed, decentralized way of doing care, micro healthcare communities that are organized around the end-to-end, but in macro ways that can be more efficiently deployed, right? In these kinds of circumstances, I think are the way of the future. So we have to start thinking about that. And believe it or not, a lot of good work is being done on the continent.
Oh, yes, I know. I've been keeping tabs. Exciting.
And so I clearly state that, in that a lot of good work is being done on the continent. Resources are very scarce. So some of those efforts are not getting the full effect they could, just because resources are simply just scarce.
Yeah.
But as with anything else, it takes a while for it to become more ingrained and for it to be a way of life and a way of approaching healthcare. And I'm hoping that this effort become sustained, because eventually the donor money that came in for COVID and all that is going to dry up.
Mm.
So now that, now that we have a crisis, it's a chance to set those things and find ways, start thinking of ways to actually sustain this long term, because it may not be Corona today, it will be something else. Besides, there are other issues that are ongoing anyway.
That were already sort of underlining.
Mortality, Lassa fever, all those kinds of things that crop up from here, from time to time, that need to be addressed, right? That this, I think, provides opportunity now that everybody's attention is on healthcare to actually start having these hard conversations. And actually keeping people staying on message and sticking with the program for a while, because these things and culture of care, remember, there's a culture to healthcare, right? The culture of healthcare needs to be built too over time, and that is not only from the patient healthcare seeking behavior point of view, but also from a professional delivery point of view, right? So we need to build those things simultaneously. On the professional delivery point of view, it means that we're able to be more diligent in how we take care of patients. We follow up, we do the things that will keep our patients safe. On the patient side, we need them to come in early to seek care so that they're not showing up with stage 3 something, and you ask them, they've noticed this 2 years ago.
Chronic diseases have been there, and they're just like, oh, right. Those symptoms? That's nothing. It's like you've been walking around.
Yeah, ultimately, those things are expensive, for any healthcare system. But more importantly, they're expensive not only from a community point of view, because if you're losing young people to things that could have been prevented, that's not good. And it's bad for the economy, right? Because, you're not getting the full lifespan of people actually participating in the economy and contributing to the GDP. So there are so many layers to this thing that we really have to look at.
Wow. This has been an amazing conversation. We've come to the end of our chat. I very much appreciate your your openness, bringing your expertise to the table, and this idea of culture of care, putting the patient at the center of care and actually creating solutions around true care to the patient, what that process looks like. And then you touch on the practitioner side, what that needs to be, things that in areas that leadership needs to be thinking about when it comes to looking at embarking on digital transformation at large. Dr. Muri, I value your time so much. Thank you. Thank you once again.
I appreciate it.
You have a beautiful rest of your day.
You too.
Bye-bye. What an amazing conversation with Dr. Muri. If you enjoyed it, share with a friend. And make sure to leave a rating and a review on Apple's iTunes podcast. And as you know already, we don't walk to the Rozy Effect, we run to the RozyEffect.com. That is TheRozyEffect.com, and subscribe, because I don't want you to miss out one other amazing conversation with a leader really taking charge and leading transformation within their industry and their organization. Until next time, I'm your host, Rozy Amponsa.